somebody that does have high blood pressure that you want to help them with, or you might just want to know how to prevent it in your life, or just learn how to be healthy on an everyday basis, so you don't end up with heart disease and other issues related to cardiovascular risk factors. I think the biggest thing about blood pressure is knowing what normal blood pressure is. Oftentimes I'll see patients in the wellness center, and oftentimes they'll say, well, my blood pressure is usually normal. But then when I ask them, well, what is your blood pressure? Then they sometimes don't realize what normal really is. So if you go to a doctor's office, or even if you're out shopping and you sit down at a pharmacy and have your blood pressure checked, you need to know where normal should be for you. And for everybody, normal is less than 120 over less than 80. Pre-hypertension will start between 120, or is between 120 to 139 on your top number, the systolic blood pressure, and between 80 and 89 on the diastolic number, or the bottom number. Stage 1 hypertension starts 140 and goes to 159, and then the diastolic number is 90 to 99, and then you have stage 2 hypertension. Well, the biggest thing that I tell people is I want your blood pressure less than 120 over less than 80 the majority of the time. And there's a lot of grieving that goes on in the wellness visit if you have high blood pressure, because I'm often told about how the many things that caused their blood pressure to be elevated that day when they came into the office. Either they ran in, bad traffic, bad conversation, didn't get much sleep the night before, under a lot of stress. So there's many reasons why they believe they have caused the blood pressure to be up, and not that this is their baseline blood pressure reading the majority of the time. So I always encourage people to monitor their blood pressure at home, and I have a blood pressure documentation card, and if you go to the cardiowellnesscenter.org website, under Health Tools, you can print out a blood pressure documentation card for yourself, or you can just start making your own documentation list of your blood pressures. But I always tell people to monitor their blood pressures 2 or 3 times a week, and if the majority of them are greater than 130 on the top number, the systolic blood pressure, or if they are greater than 80 on the diastolic number, the bottom number, then I'd like for them to call our office, or you guys can call your normal primary care provider to discuss your blood pressure being elevated, because you do want us to treat your blood pressure how it is the majority of the time. It looks like we've had some questions that have come in early, and so as I go through the presentation, I'll try to answer some of the questions. One of the questions, and it's what I often get from patients, is when's the best time to check my blood pressure? And so I always tell people that I want you to check your blood pressure how you feel the majority of the day. So it's not necessarily every day at 4 p.m. If I was to tell you that at 4 p.m. you could be waking up from a nap, or you could be rushing home from work. So time is not necessarily what you need, as much as you want your healthcare provider to treat your blood pressure how it is the majority of the time, not some obscure time where it was just up for a short period of time. So I always tell people to think how you're feeling the majority of the day, and that's when you want to take your blood pressure. Blood pressure and cardiovascular health is all about a balance, and it's about a balance of your autonomic nervous system. And you have a sympathetic tone and you have a vagal tone. We're all made for that. We're all made with a sympathetic tone and a vagal tone. And the more sympathetic tone that we have, the higher our cardiovascular risk, because it's a sympathetic tone is enhanced by being sedentary or having increased stresses in our lives. It's also enhanced with diabetes and heart failure and depression and being on stimulants and having sleep apnea. All these things increase our risk for cardiovascular disease, and they increase our risk for with having high blood pressure. So our overall health and our overall blood pressure is just a balance. We want to support and increase our vagal tone. We want to have good social support in our lives. We want to have good exercise. We want to have good meditation and omega-3 fats. Beta blockers and ACE inhibitors are some of the blood pressure medications that can help give us some vagal tone. And we'll talk about blood pressure medications. I think there's some questions that have come in, and I'll try to address those as we go. But it is all about a balance of our sympathetic tone and our vagal tone. It's interesting is we have a renin-angiotensin system in our bodies. That's how we are made. And that renin-angiotensin system is in our bodies so that it can raise our blood pressure when we need it and to keep it normal when we don't need it to be raised. And so here is an example. If you see, or if we, any of us, saw this dog coming at us, we would want our renin-angiotensin system to work. We would want it to constrict our vessels and increase our blood pressure so we can stay and fight off this dog or run like heck to get away from it. We don't want to pass out and faint. So our renin-angiotensin system is here in our bodies for short-term activation. So it restores our volume, it gives us vascular integrity, it constricts our vessels, maintains our blood pressure when we see something like this dog that could be coming at us. But what happens now in real life is that we have foods that we eat that cause long-term activation of the renin-angiotensin system. And that's not what the renin-angiotensin system was designed to do. It was not designed to be activated long-term. And when it is activated long-term, we have plaque buildup. And hypertrophy is just the thickening of the vascular wall. So plaque thick-up, the wall's thickening, we've got more clotting, fibrosis is clotting, so more volume all the time and more clotting, and we end up degrading our vascular wall, and we end up having issues. A study was done by Dr. Vogel, and if you've seen some of my prior presentations, you might have seen this slide before, but this is a study done by Dr. Vogel, and it looks at blood flow through the artery at baseline, and you can see the blood flow through the artery at baseline here. And then 4 hours after a high-fat meal, so after your hamburger, fries, shake, and dessert, you can see that the blood flow through the artery wall is not even half of what it was at baseline. And then 6 hours later, it's still not back to baseline, but we're often on to our next high-fat meal. So it's really interesting is when we eat these terrible foods, it really does affect our artery walls. In fact, it does a lot what smoking has been known and done to us in the past. Now, I always say if we were going to bring a giraffe into the Kansas City Zoo, and if we were going to want it to live a long, healthy life, we would put it in its natural habitat. We would feed it what it's naturally and genetically designed to eat. But if we took that giraffe and we Americanized it, and we gave that giraffe saturated fats, trans fats, and sodas, that giraffe would have the same problems that you and I see in America today. So it's really important that we eat what we're genetically designed to eat. If not, we are going to get high blood pressure and high cholesterol and heart disease and diabetes and obesity and sleep apnea. All of this leads to all of the cardiovascular risk factors really stem from a lot of our diet and lifestyle. And if we can control diet and lifestyle, we can get most of our risk factors under control. One of the questions that came in was, is high blood pressure gene related? I think there's been some studies. I can't recall one off the top of my head, the name of the study right now, but I'm pretty certain there's been some studies that show that in children whose parents have high blood pressure, that they have an increased risk for high blood pressure. But there's also the component that we eat foods that are high in sodium, and it might not be all genetics. It could just be what we're eating and the lifestyle we're living. For instance, pizza is the #1 junk food, loaded with sodium. And if we're going to eat pizza and have high sodium and salt intake all day long, we're going to have vascular degradation of our vascular walls. We're going to have high blood pressure, and we're going to have heart disease. We're going to have big issues if we continue to eat tons of sodium, tons of cholesterol foods. This slide really changed how I practice and how I help my patients to control their blood pressure. This was a study done by Dr. Weiss in 2001. And if you look at the left-hand corner picture, the standard diet, this is a slice of aorta for mice. And the standard diet, they gave these mice healthy chow for 8 weeks. And when you start to see the white spots, that's plaque buildup. So they gave them healthy chow for 8 weeks, and you don't see a lot of white spots or plaque buildup. But then they fed them a trans fat, saturated fat diet for 8 weeks. And you see there starts to be a little bit of plaque buildup here. And then if you look at the bottom left-hand picture, this is a healthy chow, but they raised their blood pressure because they raised the angiotensinogen. They raised it, and they raised their blood pressure, their top number, to 140 to 150. And you start to see more plaque is forming on a healthy diet with the high blood pressure. Well, then you take a trans fat, saturated fat diet and a high blood pressure of 140 to 150. Look how much plaque built up. It's absolutely huge. So 1 plus 1 on your risk factors doesn't necessarily equal 2. It could be a 90% fold increased risk for heart disease. So it's really important that we lower the sodium in our diet, watch our blood pressure, but also watch our diet as well. Many patients will say, oh, you guys just keep changing the guidelines. And we hear that all the time. I will tell you the blood pressure guidelines I don't think have changed in the last 10 years much at all. In fact, it was probably 5 years ago, I had an 80-year-old man come into the office and said to me, shouldn't my blood pressure be 100 plus my age? So that meant his normal blood pressure would be 180. So we know that's not true. We know it shouldn't be that. But we've learned a lot from science and from research, and just by studying healthy Americans. And if we look at these Indians here in this study, these Indians are hunter and gatherers. They live off the land. They don't eat pizza. They don't eat foods contained with sodium and high cholesterol. They eat what they're genetically designed to eat. And if you look at them, both males and females, and if you look at their top number of their blood pressure, the systolic number is not anywhere from the males from 93 to 108, and the females was 96 to 106. And if you look at the diastolic, it's anywhere on the males anywhere from 59 to 69, and on the females it's anywhere from 62 to 64. So lowering the blood pressure is not just better. Lowering the blood pressure is normal. If we live like we're genetically designed to live, we would have these kind of blood pressures. There's many times people have had high blood pressure for so long that when they get to 120 or 110, they'll say, oh, I think my blood pressure is too low. But again, we need to know what normal is, and we need to strive to get to normal. A lot of patients in the clinic will tell me, you know what, you can give me a heart attack, I can survive that, but please, whatever you do, don't give me a stroke. And high blood pressure is associated with strokes. And I find this fascinating. A lot of people don't tell you where your neutral mark or where there's no increased risk of having a stroke is on the blood pressure. But if you look at all the studies out there and you look at hazard ratios, you want to look where the 1 is, because the 1 is a neutral risk. Anything higher than the 1 would show increased risk. Anything lower than 1 would show a decreased risk. But 1 is a neutral mark. So if we look at where 1 is in this study for risk for stroke, we can see that the 1 is a top number of your blood pressure, systolic blood pressure being less than 112, and the diastolic being less than 71. And we're shooting for everybody to be less than 120 over 80 to be normal. So it is important to know your numbers. It is important to change your diet and lifestyle to optimize and prevent high blood pressure. The other thing that a lot of patients won't want to do is they won't want to be on a blood pressure medicine, so they'll try to postpone it. And so they'll go a few years without being on blood pressure medicine because they don't feel that it's hurting them. They don't physically feel it. Well, what happens is we've got 4 chambers in the heart. The 2 chambers on top are small atriums, but the big chambers on bottom are ventricles. And if you just think about your left ventricle, it's shaped like a football. The left ventricle is shaped like a football, and its job is to eject blood to the rest of your body. And if it is ejecting blood to the rest of your body over high pressure for a long period of time, the walls of that ventricle will thicken. And when the walls of that ventricle thicken, you no longer have a football shape, but you have a basketball shape. And you're not able to push as much blood out, and you now have heart failure. Most heart failure is precipitated by blood pressure that is gone untreated. So what people try to prevent 1 or 2 medicines today from taking ends up being 5, 6 medicines a decade or so from now because we end up with heart failure. So it's really important if you know to know your numbers and to get your blood pressure under control. Just by controlling your blood pressure, you can reduce your risk of developing heart failure by greater than 50%, reduce your stroke risk by 35 to 40%, and reduce your risk for having a heart attack by 20 to 25%. And that's just by getting your blood pressure under control. There's been a meta-analysis with over 1 million adults completed, and this was done in 2002. And I found it really interesting is that even lowering your blood pressure by 2 points, your top number of your blood pressure by 2 points, you're reducing your risk of early heart disease death by 7%, and you're reducing your risk of death from a stroke by 10%, just by reducing your blood pressure by 2 points. And so there's a lot of simple things that we all can do to reduce our blood pressures. You know, one thing is we need to get rid of some of our belly fat. We need to exercise and get rid of the fat that we've added on over the years and know what our numbers are. Some ways to get rid of the fat that we have that we've added on over the years is not only just through exercise, it's changing our diet and even getting on some supplements that might help you. The CardioTabs through CardioTabs I often use a lot because it does help get rid of some excessive belly fat. Now you can't just pop a pill and then eat pizza and say my belly fat's going to go away, because that's obviously not going to happen, although some of you probably thought I'll buy that tomorrow if that's what's going to happen. No, but what happens is it does eat away at that excess layer of fat. It's also powerful an antioxidant, so it boosts your immune system. It does helps to increase your metabolism in a normal way. So that will also help to help you by reducing your belly fat, improving your immune system. All will help to lower your blood pressure. The other one is what I would consider a lot to use CardioTabs has is the omega-3 fish oils. That helps. Fish oils is one of the most well-studied supplements that's out on the market today. I don't think there's any other supplement that's been studied to the extent fish oil has. It helps every cell of our bodies. So it reduces inflammation. And when you have high blood pressure, what happens? We have more inflammation. And fish oils help to reduce inflammation. I know we're going to have a code at the end of the seminar to help with, or there will be a code in the seminar for a reduction in some of the CardioTab products. And I appreciate CardioTabs allowing me to do the seminars. But it is important that we look for blood pressure. Some other natural ways to lower your blood pressure, not only through exercise, but is to limit your salt consumption. And this is huge because we are a salt-eating world. Even if I have patients that say, well, I don't add salt. Okay, but they eat out 5 times a week. When you eat out, when you have hamburgers and fries, loaded with sodium. Soups, loaded with sodium. Crackers, loaded with sodium. Pizza, #1 junk food, loaded with sodium. Really, when you look at your plate, you need to have lean protein in fruits and vegetables. And so I don't mean putting salt on watermelon and tomatoes. So I always tell people you got to remove the salt shaker, do without the salt, but have lean proteins in fruits and vegetables, and your salt consumption just naturally will go down. Reducing stress in your life will help to lower blood pressure. If you need to lose weight, even 5 to 10 pounds is going to help your blood pressure. People don't realize often they think, oh, I have to lose 20 or 25 pounds to get my blood pressure better. If they even lost 5 to 10 pounds, they would see a reduction in their blood pressure. And a couple of other important natural ways to lower blood pressure is if you drink, we recommend no more than 1 or 2 drinks a day. As you get higher on the amount of drinks that you consume, blood pressure goes up. That's why I think Dr. O'Keefe is he's a cardiologist and the medical director of our Cardio Wellness Center, and he calls alcohol a double-edged sword. If you have 1 or 2 drinks, it's beneficial. If you can't do that, it's going to be detrimental to your health. And you can't save 1 or 2 drinks up until Friday and end up with 7 to 14 drinks on Friday. That doesn't work. But it's all about if you're drinking a lot of alcohol and your blood pressure's up, cut back to 1 or 2 drinks a day and see if your blood pressure doesn't come down. The other thing is if you snore at night, that's not a normal way to sleep, and that's not what you normally should do. You shouldn't be snoring at night. If you do snore at night, discuss it with your healthcare provider, because it could be a sign of sleep apnea. And how sleep apnea is associated with heart disease is that it raises your blood pressure. So when you quit breathing at night, your oxygen in the blood, because blood carries oxygen, So the oxygen in the blood goes down. And what does your arteries do? Your arteries constricts because it tries to save the oxygenated blood for your vital organs. And then when your mind says, hey, buddy, you better wake up and breathe, and you take a deep breath again, and then in the next 60 seconds, your oxygen level goes down, and you have high blood pressure again. So a lot of sleep apnea can lead to the high blood pressure and sometimes some resistant high blood pressure that people can't get under control. So if you snore at night, it would be worth having a discussion with your healthcare provider in regards to, do you have sleep apnea and what are ways to treat it? And there's some sleep apnea that is anatomical that you can have surgery for, but a lot of sleep apnea is being overweight. And if we can get our weight down, it will help to reduce sleep apnea symptoms. The best thing that I can recommend for you is to know your numbers, not to have someone say your blood pressure is normal, but to know your number and know what it is. Are you around 120? Are you around 138 on your top number of your blood pressure? It's important to know, is your diastolic, your bottom number, is it around 70 or is it around 84? There's a big difference. How much are you putting the pressure on your heart? If you need to have your risks assessed, or if you're interested in having your risks assessed, or if you don't have a primary care provider, you can always call our clinic, and our number's on here, and make an appointment. We can assess all your risks. And if you want to learn more about us, I have our website on this screen. But if you go to that website and you go under Health Resources, you can download our blood pressure card if you want to just keep your blood pressure documentation on that. I'm going to answer some questions for you. This is the code that CardioTabs have given us. So if you enter code pressure at checkout, you do save 10% on your CardioTabs orders. And I'll try to go through some of these questions. Do controlled breathing exercises or yoga help lower blood pressure? And yes, they do. And I think both of those things are very healthy. How do doctors determine which medication is right for you? Examples were beta blockers, lisinopril, or hydrochlorothiazide. That's a great question. So hydrochlorothiazide for many, many years used to be the gold standard. But what we've learned with hydrochlorothiazide is you have a little bit more increased risk for diabetes with it. It's inexpensive, and it's been around for a long time. You've got to watch the potassium because it's like a mild diuretic. And how I describe hydrochlorothiazide to my patients is it's not a diuretic or boom, you're going to the restroom every 15, 20 minutes for the next 4 hours. It is actually a blood pressure diuretic, and it kind of just keeps your fluid status throughout the day kind of at an even level. And then if you have too much sodium and you retain too much fluid, the next time you go to the bathroom, you're going to have more volume. So it's not necessarily where you have to go to the bathroom multiple times with hydrochlorothiazide. But that one used to be the gold standard. But since then, we've had other studies that say, oh, lisinopril and beta blockers in certain populations have actually done better. So lisinopril is an ACE inhibitor. Lisinopril is an ACE inhibitor, and ACE inhibitors actually are beneficial to help improve heart function. They're also beneficial to help prevent diabetes. They're kidney protective, and they lower blood pressure. So ACE, and they're generic as well, so that they're not as costly as some of the brands, some of the other brand categories. So oftentimes we'll use lisinopril if someone's pre-diabetic or has kidney disease, or that's usually the kind of the go-to thing, unless there's something else specific. For instance, beta blockers. With beta blockers, they can be added on to the lisinopril, or they can be started at the very beginning. On beta blockers, what they do is they slow your heart rate down, so your heart's not racing. It prevents that adrenaline response. So some people are just geared up people, and if we do a 24-hour blood pressure monitor on them, it's interesting. And the minute they wake up, the blood pressure soars, and then the minute they go to sleep, the blood pressure plummets because they are just geared up. And those people, if I put them on a lisinopril, it might lower their blood pressure some, but if I put them on a beta blocker, it would really lower their blood pressure because it's blocking that adrenaline response they have as they're just geared up every day. Also, if you've had a heart attack, the two drugs that you need to be on are lisinopril and beta blockers. They both have shown great reductions in further events. So we always look to have them on lisinopril and beta blockers. If you're having swelling in your feet and your blood pressure's up, then we would start with hydrochlorothiazide because that would help get rid of some of the swelling in your feet if it was related to fluid status. So that's some ideas on how doctors decide what medication is right for you. It kind of depends on what other comorbidities that you have. So the next question is, I think I kind of smiled when I read this just now. I feel like my blood pressure really rises when my spouse stresses me out. How many points can it rise? That's a good question. I guess it depends on how much you let it get to you. How many points should you let it rise? I think if your systolic blood pressure is consistently above 130, you need to let somebody know. Now, if it gets up to greater than 160 on a one-time basis, it's there for a short time, that's not such a big deal. But if it gets up to over 160, I would definitely, and it's staying there, I would definitely call. Again, I would call if it was consistently above 130 on your top number. Can you take meds for high pressure and remain on birth control pills? Absolutely you can. On medical information forms, do I still answer yes to high blood pressure if it's been okay for years with treatment? Yes, because you still have high blood pressure, so you would still answer yes, but you've got it under control with treatment. So you can just say yes, and if you wanted to write beside it controlled, that's fine. You don't have to, but they're just looking for if you do have a history of high blood pressure, then they'll look to see what you're taking. So somebody was asking about, is there ways to fight low blood pressure? And that's interesting. I have low blood pressure myself, and I hope I always have it. But when you have low blood pressure, I usually start my day off with some caffeine, but I do caffeinated tea because that helps. I also make sure I have a big breakfast because if I'm depleted when I start my day, my blood pressure is just going to go lower and lower and lower until lunch comes. I make sure I drink plenty of water. So things like that are going to be really important. Make sure you drink plenty of water, have some caffeine, healthy caffeine, not soda pop, but like tea or coffee. And those things would be helpful for you to keep your blood pressure up. So this is a good question. I get this a lot. What are safe low numbers for blood pressure? And I always tell people low blood pressure is really associated with longevity. So as long as you can stand up and walk and you don't have issues with lightheaded and dizziness, then that's fine. But if you're having issues with lightheaded or dizziness, then you should call and talk to your primary care provider about what you can do for the low blood pressure numbers. Now, if you're on medication and your systolic blood pressure, the top, or systolic blood pressure number, the top number of your blood pressure is consistently under 100, you need to call because that's probably too low, and that's being driven by the medication, not because of your natural ability to have a low blood pressure. And then the last question is vascular blockage reversible? I think what we've learned in all the scientific studies this far is that we can regress plaque just minimally, but we can stabilize it greatly. And so the key to plaque is you want to stabilize it. You want to get risk factors under control. You don't want to do anything to inflame or agitate or put pressure on the current plaque that's there. So the key point is to get all your risk factors under control, particularly your blood pressure, you have a better chance of stabilizing your plaque. Well, I appreciate everybody taking your time. I appreciate everybody taking the time to listen to the seminar today. And
great job, Becky. There will be a recording of this made available that I'll send out in the next day or two. You'll be pinged automatically. Thanks again for attending. You can always post ideas for future webinar topics. We're always looking for new and exciting topics to discuss on either CardioTabs Facebook wall or the Cardio Wellness wall. You can email me directly at info@cardiotabs.com, and we'll make sure and answer your questions. Thank you, everyone.